Hello friends, good evening. Welcome to the recall of pediatric questions that came today in FMGE 2024. So, we are very sorry we could get, just a sketchy, a sketchy outline of the questions, and some might not be authentic. Please help me. I apologize in advance if any question, if I discuss with you, had not actually come. So, we will come back again with a proper recall later on, but this is what we could lay our hands upon, and kindly help us, right? So, good evening once again, and let us get going. So, the first question which came to me was there were two questions on Turner syndrome, and I was so delighted because in Guess the Paper series, that was the last topic I had very nicely covered with you. And the first question which was told to me was a teenager was brought to, you know, okay, so a teenager was brought to OPD with complaints of delayed puberty and secondary sexual development. On examination, it was diagnosed as Turner syndrome. It was already given. Which chromosome is involved in Turner syndrome? So, very nicely, it was discussed with you in the Guess the Paper series, which we had done last month. And here we all know that it is the XO chromosome, which is involved over here. There is deletion of one X chromosome, and the genotype is XO, and that is responsible for the Turner syndrome. So that was one question. I hope this was the question which had come. And the second question which came with regards to Turner syndrome was regarding its features. So one of the students told me that, ma'am, कई सारे features दे रखे थे, regarding the Turner syndrome, but only one was right, and the one which was right was webbing of the neck. So of course, yes, that student is absolutely correct. Webbing of the neck is a feature of Turner syndrome. We had discussed in detail. So this is the pick from our Guess the Paper series, where we had discussed that the child has wide carrying angle and shield type chest, widely spaced nipples is there. Then of course low hairline is there, webbing of the neck is there. Then you have the nevi, all brown nevi all over on the body, and of course you have the rudimentary ovaries or the streak like ovaries, and that is probably responsible for the delayed puberty and delayed menarche or absent menarche, right? And then there is poor breast development and poor secondary sexual development of the secondary sexual characters is definitely delayed, and that was what was given in the first question. So this was discussed in detail, and again here the correct answer was webbing of the neck, although I could not find out the other the other features of Turner syndrome which had come. So I hope this was only the correct feature which was mentioned, and this is the correct answer, right? Okay, then okay, then let us move forward. Next question was, so these are all the features which we had discussed, and of course the commonest congenital heart defect is, we had discussed at that time, bicuspid aortic valve, and the second commonest is the coarctation of aorta. So remember, coarctation of aorta is not the commonest heart defect seen in Turner syndrome, right? So this you should be very clear with. So let us now move forward. This was again the question which was, told to me that it was an image-based question. The child, a newborn, or maybe, in the infant period, presents to you with some swelling which is noticed some time after birth, and this swelling was given, and what is the diagnosis they had asked. So it is very clear from the swelling that the swelling was cephal hematoma. Okay, and okay. Turner पे question था, color one child with diarrhea, symptoms drinking. Okay, we will discuss that also. Dr. Movie Zone. Turner पे दोनों questions मेरे ठीक हो गए. Good. 45 XO. Okay, so let us discuss this question, and then we'll come to your question also, because actually I'm waiting, updates from you. So what was the identify the below given condition? So this is cephal hematoma. Of course, the other options could be caput succedaneum and subgaleal hemorrhage, because they are the close differential diagnosis over here. And luckily we had discussed this question also in Guess the Paper series, and here you can see that yes, I had given you the image of hematoma, both the radiological image and the actual image. And we had discussed this question, that cephal hematoma, it is the swelling which is there on one bone. It is a swelling because of the collection of the blood in the subperiosteal region. The bridging veins which are there in the subperiosteal region, they rupture, and that is why the collection of blood is seen, right? So okay, so this is it. Okay, so चलो आगे चलते हैं. दो image was that of hygroma. Okay, hygroma भी आया था, cystic hygroma somebody is saying. Okay, this wasn't there, so cephal hematoma was not there. चलो कोई बात नहीं, ठीक है, आज हमने पढ़ लिया, ठीक है. Let's hope आपको जरूरत ही ना पड़े next time to attempt again the FMGE exam at least, and probably this will help you in your NEET PG examination. So let us get going forward. Anencephaly occurs due to inability of neural tube to close in which week of intrauterine life? So this was the question which was again given to me, and this was probably the first question which which was put in front of me कि मैम ये pediatrics से आया है. And I was so again glad because this was very clearly discussed in notes with you, that all the neural tube defects which are also referred to as dysraphism, in obviously anencephaly is a neural tube defect, occurs because of failure of neural tube to close spontaneously between the 3rd and 4th week of in utero development. So definitely over here the correct option is going to be 4th week of life. Yes, so 4th week of life, this is the correct option. And because the neural tube fails to close spontaneously between the 3rd and 4th week of intrauterine development, these were the options, and of which third, there would be either one between them. Between 3rd and 4th week, there should be the one option only. So if we just go by one option, there would be something either the 4th week or the 3rd week. Both options could not have been given in the question, right? So that we have to take care of. Okay, then next question which was coming which was given to me was, identify this child with the lump over here. Again, we had discussed this question again in detail. I hope this was there in your paper. And this is this something which protrudes out of the abdomen and is covered by a covering. So this covering actually tells you that this is omphalocele. So I had seen in your chat ki omphalocele pe question tha. Of course, we had again discussed omphalocele in our Guess the Paper series. I had given this question, identify the condition, ki bachcho सीधा सीधा ये question आता है. The distinguishing features would be that there would be intestinal loops. There can also be protrusion of organs like liver and spleen, but it would be covered by a membrane which we all know by the name of peritoneum. So if you have the peritoneal covering, then the diagnosis becomes omphalocele. Otherwise, the diagnosis, if it is exposed, then the diagnosis becomes gastroschisis, right? So I hope this was there in your this thing. So I hope this question was there in the paper, and of course the correct answer to this is omphalocele, which I hope everyone has done it correctly, right? Okay, now let us move on to the next question. So the next question was, so this was the, we had discussed at that time difference between gastroschisis and omphalocele. Coming to the next question, stranger anxiety appears at what age? Again, bachon, stranger anxiety, I cannot see your chat actually. Okay. Okay. Ma'am, omphalocele या omphalomycentric cyst था. Okay. So बच्चों अगर ये if the diagram given was this, then this is omphalocele. Omphalomycentric duct होता है, that is something different, जिसमें कि अलग सा picture होगा, but this is definitely omphalocele over here, right? Chat नहीं दिख रहा मुझे, एक बार देखना. Okay, then stranger anxiety appears at what age? This was what was told to me. Was this the question there, guys? Please tell me, girls and guys sitting over there. Okay, so stranger anxiety, we all know, comes by the age of 6 to 7 months. Okay. सो स्ट्रेंजर एंजाइटी कम्स बिटवीन द एज ऑफ 6 to 7 months. अगर आपका ये क्वेश्चन आया है तो इसमें करेक्ट आंसर इज गोइंग टू बी द 6 months की स्ट्रेंजर एंजाइटी, बच्चा स्ट्रेंजर को देख करके, अगेन वी हैड डिस्कस्ड इन गेस्ट द पेपर सीरीज दैट स्ट्रेंजर एंजाइटी कम्स एट अराउंड 6 to 7 months, right? Okay, then I hope this question was there. The picture was not there, ma'am. Of course, yes, the picture was not there. तो डॉक्टर गरिमा क्या था, बिकॉज आई वॉज टोल्ड दैट स्ट्रेंजर एंजाइटी था. Okay, then next is features of angular cheilitis, stomatitis and glossitis is seen in which vitamin deficiency? तो बच्चों ये बताओ, vitamin deficiency आया था क्या? glossitis, cheilitis, angular cheilitis, this is seen in which vitamin deficiency? Was this the question? हाँ, आई एम कमिंग टू दैट. डॉक्टर असगर गोरी टेल्स मी वन हैंड ऑब्जेक्ट ट्रांसफर था, ठीक है, सोशल एक्टिविटीज नहीं थी. ओके ओके, वन हैंड ऑब्जेक्ट ट्रांसफर था एंड सोशल एक्टिविटीज नहीं थी. वी विल कम टू दैट क्वेश्चन ऑल्सो, वो भी क्वेश्चन मैंने इंक्लूड किया है. ओके, सो बताओ फीचर्स ऑफ एंगुलर चिलाइटिस, स्टोमाटाइटिस, glossitis seen in which vitamin deficiency? Was this question there? If this question was there, again we have discussed, this is classic deficiency of vitamin B2, that is riboflavin. अब वो vitamin B2 था कि riboflavin था, वो मुझको आप नहीं पता कि ये options में था कि नहीं. So if it was there, okay, so riboflavin, yes, Dr. Yashwant says riboflavin. Okay, yes, so this is riboflavin deficiency or vitamin B2 deficiency. Xerosis था, Dr. Rudra Sinha says xerosis था. अगर conjunctival xerosis है तो even conjunctival xerosis, remember, can be seen. Corneal vascularization and cataracts are a feature of vitamin B2 deficiency है, riboflavin deficiency, ठीक है. And अगर एक night blindness का question था, वो तो सीधा सीधा vitamin A deficiency पे था, ठीक है. साथ में इस क्वेश्चन नेकलेस पैटर्न वाला क्वेश्चन, हाँ हाँ, कसाल नेकलेस वाला क्वेश्चन भी करेंगे, डोंट वरी, वो तो वी हैव इंक्लूडेड. ओके, देन विच, सो दिस इज द कसाल नेकलेस. क्या ये क्वेश्चन आया था जहाँ पे कसाल नेकलेस दिया हुआ है? दिस इज बिकॉज ऑफ विच वाइटामिन डेफिशिएंसी? डॉक्टर सोहेल खान, नेकलेस पैटर्न ऑल्सो इन द सेम क्वेश्चन, कसाल नेकलेस था. So this everybody knows कि अगर ये question आया था which vitamin deficiency was this, so this is because of, everybody knows this is because of niacin deficiency. अगर niacin नहीं लिखा था तो vitamin B3 deficiency लिखा होगा, so vitamin B3 deficiency था. Okay, ठीक है, niacin था, डॉक्टर अल्ताफ is saying niacin था. Okay, then burning feet syndrome is due to which deficiency? क्या ये question आया था? Because I was given this. This is again because of pantothenic acid deficiency. Don't worry guys, ठीक है. अगर आपको लग रहा है this recall में सारे questions included नहीं हैं, we will come up again with a genuine recall. This is what the students gave us. We have not manufactured these questions, right? So burning feet syndrome अगर आया था, so this is because of the pantothenic acid deficiency, or as we all know, vitamin B5 deficiency. So अगर burning feet syndrome था तो tryptophan भी पूछा था. Yes, so अगर tryptophan, अगर ये पूछा था कि niacin किस से मैन्युफैक्चर होता है, तो वो tryptophan से होता है in the body. But remember, tryptophan का 60 parts tryptophan लगते हैं, तब जाके 1 molecule of niacin मैन्युफैक्चर होता है. तो it is not a very efficient this thing manufacturing taking place in the body, ठीक है. तो कुछ कह रहे आया था, कुछ कह रहे नहीं आया था. चलो एनीवेज, तो बच्चों अगर नहीं भी आया था, जस्ट पे अटेंशन, दिस माइट कम, यू हैव मेनी एग्जाम्स टू गिव लेटर ऑन, नीट पीजी भी देना है, वहां पे आ जाएगा, कोई बात नहीं, नथिंग टू वरी, वी विल अगेन कम अप विद अ जेन्युइन रिकॉल, डोंट यू वरी, राइट. सो दिस इज बर्निंग फीट सिंड्रोम इज पैंटोथेनिक एसिड डेफिशिएंसी. फिर वन हैंड टू अनदर ट्रांसफर, ये अभी किसी ने बताया, साथ में था विद नो सोशल एक्टिविटीज, मतलब नो सोशल इंटरेक्शन. तो वी नो सी सोशल इंटरेक्शन यूजुअली स्ट्रेंजर एंजाइटी, जैसे हम कहते हैं 6 to 7 months पे आता है, एंड वन हैंड टू अनदर हैंड ट्रांसफर कब आता है? 6 months पे आता है. तो यहाँ हमारा जेन्युइन सा आंसर यहाँ पे होगा 6 months, राइट. ओके, दो क्वेश्चन थे, वन वॉज ट्रिप्टोफान के बारे में एंड सेकेंड वॉज पेलेग्रा। तो बच्चों अबाउट ट्रिप्टोफान, थैंक यू डॉक्टर अल्ताफ। ट्रिप्टोफान के बारे में आई एम श्योर डॉक्टर अमित द बायोकेमिस्ट्री फैकल्टी विल डील विद इट। एंड जहाँ पे पेलेग्रा के बारे में था, डर्मेटाइटिस हो गया या कैसल नेकलेस हो गया, तो वहाँ पे वी हैव ऑलरेडी सीन कि दिस वॉज बिकॉज ऑफ नियासिन डेफिशिएंसी। सो वन हैंड टू अनदर हैंड ट्रांसफर्ड विद नो सोशल इंटरेक्शन, 6 months यहाँ पे होगा। ठीक है, कुछ और आप बता सकते हो इफ यू वांट टू गिव सम अदर इनपुट्स, आई एम रेडी फॉर दैट। कमिंग टू द नेक्स्ट क्वेश्चन, नाइट ब्लाइंडनेस इज कॉज्ड बाय विच विटामिन डेफिशिएंसी? सो नाइट ब्लाइंडनेस इज कॉज्ड बाय विटामिन ए डेफिशिएंसी, वी ऑल नो दिस, वी हैव ऑलरेडी this thing discussed it in detail. Night blindness आपके because of the WHO classification में भी आता है XNFS, and XN stands for night blindness. So that is because of vitamin A deficiency. Next was bleeding gums are a manifestation of which vitamin deficiency? Again, this was vitamin C. It seems सारा vitamin के बारे में ही पूछ लिया है। ठीक है, any other pediatric questions अगर आए थे तो मुझे बताइए। ठीक है, we will discuss that. If you want to give me any inputs, ठीक है, अगर डायरिया पे कोई क्वेश्चन, I saw in the past कि कोई डायरिया पे क्वेश्चन था, so क्या डायरिया पे कोई क्वेश्चन था? अगर था तो प्लीज मुझे बताइए। Okay, any question on diarrhea? Okay. So Dr. Surbhi Gupta had given me a question. If jaundice persists beyond 2 weeks, so what do we think? Of course, you have to think about the prolonged jaundice, and prolonged jaundice में one of the common features or is the presence of a conjugated hyperbilirubinemia, and one of the reasons for conjugated hyperbilirubinemia is biliary atresia. तो अगर ऐसा कोई question आया था persistent jaundice के बारे में, persistent jaundice means persisting beyond 2 weeks of illness, then biliary atresia can be one of the differential diagnosis. So that's what we have just seen over here. Okay, then okay, so Dr. Altaf is saying xerosis tha, not night blindness. So we know that conjunctival, अगर conjunctival xerosis भी है, समझ लो ये हम अगर काट लें और कंजक्टाइवल जेरोसिस करें तो इवन कंजक्टाइवल जेरोसिस अकर्स बिकॉज ऑफ योर विटामिन ए डेफिशिएंसी, एंड दैट इज योर इनफैक्ट स्टेज 1A, वी नो दिस राइट। तो उसमें भी विटामिन ए ही आएगा। ओके, फिर है ये था ही नहीं क्वेश्चन। यस मैम, सम स्टेज वाज आस्क्ड, सम स्टेज ऑफ डायरिया वाज आस्क्ड। कैन यू जस्ट टेल मी कि डायरिया में क्या क्या इनपुट्स दिए गए थे, क्या क्लिनिकल फीचर्स था, तो देन आई कैन हेल्प यू। Somebody had said, so if the child, very importantly बच्चों, अगर if it was being mentioned in diarrhea that if the child is drinking eagerly water, then this is your some dehydration, remember that। ठीक है, अगर ड्रिंकिंग बिल्कुल भी नहीं थी, if the child was not in his senses, was stuporous, was drowsy, then this is severe dehydration. And if the child was not having other features of dehydration and was drinking normally, then it is most likely no dehydration. क्या कुछ और था? Can you help me with this? डायरिया डर्मेटाइटिस पे क्वेश्चन था विद नेकलेस पैटर्न, बस साथ में ग्लोसाइटिस भी था। इट वाज आस्क्ड अबाउट डेफिशिएंसी ऑफ व्हिच। ओके, सो डॉक्टर सप्रम शुभम हैज मेड इट क्लियर दैट देयर वाज अ क्वेश्चन ऑन डायरिया डर्मेटाइटिस विद कैसल नेकलेस का पैटर्न, एंड साथ में ग्लोसाइटिस भी था। ऑफ कोर्स ग्लोसाइटिस कैन हैपन विद नाइसिन डेफिशिएंसी, it asked about which vitamin, so then you have to go for niacin deficiency because diarrhea, dermatitis, 3Ds जो हमारी जो होती है, they are a feature of niacin deficiency, right? Diarrhea, dermatitis and dementia. So ये तीनों Ds, 3Ds are a feature of niacin deficiency. So guys, since you people are good number over here, so therefore obviously your recall, the recall which we get from here is more authentic. हमें handful of बच्चों ने recall दिया, so probably we are not up to the mark and we'll definitely come back. Okay, then child was thirsty to drink. Okay, अगर child was thirsty था तो then it is some dehydration, because thirsty, drinking eagerly, then that means that is some dehydration. ठीक है, okay, so partner treatment. Okay, then congenital jaundice. color, child was thirsty. Ma'am, question was how many days jaundice should get resolved normally. So very good. Dr. Altaf is asking me, agar if this was the question, normally the jaundice gets resolved by 2 weeks. Okay, normally it is 10 to 15 days. So normally it should get resolved by 2 weeks, but there is no rule as such. It all depends upon in which scenario they are asking. Of course, if the jaundice persists beyond 15 days or 14 days or 2 weeks, then we call it prolonged jaundice, and then we have to look at what kind of jaundice it is there, whether this is conjugated hyperbilirubinemia or unconjugated hyperbilirubinemia, and then do investigations accordingly. But otherwise, please remember, definition of prolonged jaundice or persistent jaundice is jaundice persisting beyond 2 weeks of life. That is first 14 days of life के बाद भी अगर jaundice रहता है, then we have to look with a different angle, specifically focusing on congenital defects like biliary atresia or neonatal hepatitis. And the cause of neonatal hepatitis is intrauterine infections, very notably. ठीक है? Okay, फिर yes, 2 weeks is correct. Okay, Dr. Naushad Ali says 2 weeks is correct. Thank you, Dr. Naushad Ali. Anything else? Anything else you want to tell me? Any other questions from pediatrics? Beta trichomoniasis needed partner treatment. These, my next faculty who's going to come, obs gynae faculty, would take over that question. Any other question of pediatrics if you want to discuss, kindly, send me on the messaging and I'll definitely discuss it with you. Right. So that is it from the pediatric recall. I apologize again if some questions were not matching. We would come up again with a definite recall, and then probably that would be more helpful to you. In the meanwhile, if you have any other more questions of pediatrics, then feel free to ask, right? Okay, you can put it on the chat and we will go through that, right? One question I think which we did not discuss, and that was the color was asked about the dehydration. So I don't know whether you know this or not. There is, there are 3 categories of dehydration: no, some and severe, right? So the color coding according to IMNCI is no dehydration, very easy to remember. This is green color, right? So no hai, green hai, everything is okay. Some dehydration का color होता है yellow और severe dehydration का color होता है pink. तो मैंने अभी जाके, when I saw the chat and I saw that, now you were asking me about the color of dehydration which was asked in the exam. I wanted to clarify. This was green, yellow and pink. Green, again I repeat, was for no dehydration, and for some dehydration was yellow color, and for severe dehydration it was pink color. तो आपसे क्या पूछा गया था? I think the child was moderately thirsty, was drinking, was eager to drink. That means the child had some dehydration, and if they had asked the color, the correct answer in this case should be the yellow color, right? So the yellow color goes for some dehydration. I hope that sets the things clear. Any other questions which you want for pediatrics to be discussed, kindly put it on the chat and we'll surely get back. Thank you.